Hello and welcome to this recorded presentation for the employees of Healthy Minds Counseling Services for the benefit plan year beginning January 1st, 2024, going all the way through December 31st, 2024. My name is Bill Hammett. I'm honored to be your benefits broker. My information is on the screen there and happy to help you work through the benefit options that are available to you, understand the plan differences, help you make a good decision for you and your family. Should you need help finding doctors, getting new ID cards, with claims issues throughout the year, our team is available to you all year long. Rhiannon and Anna are great resources for you to lean on throughout the year. Quick agenda, we'll talk about the timeline of open enrollment, the medical, dental, vision plans, how do you enroll, and then of course, if you have any questions, here's our information. We'd love to help. So open enrollment is from November 20th today through December 1st, which is Friday. This is your opportunity to make any changes you want to your plans. You can add dependents, remove dependents, upgrade your plans, downgrade your plans, remove dental, add dental, whatever it may be. You're welcome to do any of those changes here in open enrollment. After open enrollment closes, if you want to make any changes, if you want to enroll or disenroll, you will need a qualifying event to do so. Any changes that you make during this open enrollment period will be effective January 1st, 2024, and we're asking everybody to complete all of this before no later than Friday, December 1st, 2023. And you will complete these applications online at the EASE portal, which I'm sure you're familiar with from previous years. We have 6 medical plans available, just like last year from United Healthcare. Same plans, very, very little in the way of benefit plan changes. We have our 3 HMO plans and our 3 PPO plans. Here's our HMO plans. We start out with the silver HMO plan on the far left. This is going to be the lowest cost option available to you. The deductible of $2,400 is something that keeps the price down, but should you need to go to the hospital, should you have emergency room needs, surgeries, you're going to pay more out of pocket. Notice the gold plan has a 0 deductible, as does the platinum. And the gold plan is a little bit lower out of pocket maximum, $7,500, than does the silver at $9,400. And then our platinum plan is our best plan available. And the most you would spend in any calendar year is $4,000 there. Another look at the silver plan, because it's a very popular one with our employees. Notice the term DED waived next to these benefits. Wherever you see DED waived, it means this $2,400 deductible does not come into play. So if I'm on this silver plan here and I need to see a regular doctor, a primary doctor, I'm going to pay $60 as a copay, deductible waived. I pay just the $60. If I need to see a specialist, it's $95. If at that specialist they order an x-ray or I need blood work, it's a $45 copay deductible waived. If they need an MRI or a CAT scan or a PET scan, that's a $400 copay deductible waived. If I need physical therapy, occupational therapy, speech therapy, deductible waived. Chiropractic deductible waived. And all the way down here at urgent care, $60 deductible waived. I point out these benefits because these are truly the day-to-day benefits that we all use, the things that are most likely to occur in our healthcare lives. And with the silver plan, it waives that big deductible for you. So for those of you that don't have a lot of needs with healthcare but are nervous about the deductible, just wanted to point out that the deductible is waived for all these physician services. So very good plan there. Gold plan, again, deductible 0, copays are lower. Brand name drugs don't have the brand name drug deductible of $400. The copays are a little lower. And then notice this gold plan here. This gold plan is a flat dollar copay for hospital stay, surgery, and emergency room. This is really nice to have a flat dollar number here because it's very easy with percentages to hit that out-of-pocket maximum. So for those of you that maybe are looking at your 2024 plan year and knowing that you have maybe a hospital stay coming up, a surgery, you're going to have a baby, maybe you get a lot of MRIs, maybe you have a lot of brand name drugs. Sometimes these gold plans can be a little more expensive, but can actually save you money when you use it. So just keep in mind how much it would have cost you to go to the hospital, $2,400 plus 40%, not to exceed $9,400. Versus this gold plan where it's just $700 per day, 5 days max. And this 5-day max means that if you're in the hospital for one continuous period of time, say it's 8 days or 9 days, once you get past day 5, on day 6, you're no longer being asked to pay that copay. Our Platinum plan has the percentages here, but notice your maximum risk is $4,000. And again, this out-of-pocket maximum is the most you would ever pay in any calendar year, no matter how bad things were. There's a family number, which is double, same thing with the deductible. This is if you have a spouse or a child or spouse and child or children added to the plan, there would be 2 out-of-pocket maximums as a maximum for the family. And this term embedded here means that no one person in the family unit would be asked to pay any more than their individual out-of-pocket maximum. So if I'm on this gold plan here with me, my wife, and our 3 kids, and I have a major medical expense, say it's $1 million in claims, I will have paid in full at $7,500, and United Healthcare pays 100% of the rest of my bills for the rest of the calendar year, and my family would have the other $7,500. So that's what the embedded means. Here's our PPO plans. Again, we have 3 options: a bronze, silver, and gold. Your bronze plan is going to be your highest deductible plan. This is really a catastrophic plan. You basically, with this bronze plan, have no coverage until you hit $6,000, meaning you will pay 100% of the cost for all doctor visits, prescription drugs, hospital stays, surgeries, x-rays, labs, all of it, until you hit $6,000, and then the plan pays 40 or 50% until you've spent a total of $8,000, at which point you'll be covered at 100%. Our silver plan is kind of a good value PPO plan, someone that values the freedom of a PPO plan, doesn't have a ton of medical needs, but might want a plan to be there for you in case you have doctor visit copays, prescription drugs, urgent care needs. This silver plan is a really great option. And then, of course, our gold plan. This is going to be our best PPO plan, our lowest deductible. It'll be the most expensive plan you see, but this is really great for any of you that have a lot of healthcare needs and really have a desire and maybe even a need for the massive choice that a PPO plan gives you. So here's our smartphone app with United Healthcare. It's called the United Healthcare app. It is the #1 thing you can do to improve your healthcare experience is download this app. Make sure you have this on your phone. This is a great way to make sure you can get to doctors that are in your network nearby. You can video chat 24/7 with a provider. You always have your ID card on you. You can see claims information. So tons and tons of things that are very helpful by having this app on your phone. So with United Healthcare, we've got a bunch of added value benefits, which are actually pretty good. We've got the EAP program. This is an employee access program. I know you all are in the mental health care space, but those who care for people sometimes need help as well. And so this program is a part of your medical plan. It is free. The number there at the bottom of the screen will get you right to a live person 24 hours a day, 7 days a week. This is a great place to go to for help managing work-life balance, drug or alcohol issues, work-life balance, marital issues, financial issues. Lots of really great options here, and this is, again, part of the program. They also have a 12-month free Apple Fitness Plus benefit, so you can get that through unitedhealthcare.com/apple-fitness-plus. It is a really nice little benefit, and as you can see, it's about an $80 value there. So really nice way to take part in your health journey. They also have the One Pass program through Rally. So this has multiple different levels of membership, but even at the lowest levels, you can access several different gyms in your area. Really, really great program. Probably one of the most popular programs at United Healthcare. So encourage you to look into this program through myuhc.com. Now we'll talk about dental. We've got our 3 HMO dental plans. HMO dental plans really, really great for those of you that just want a couple of free cleanings and don't want to pay a lot. The drawback of HMO plans, of course, is not as large of a network of dentists that are available. So beware that if you've got some very specific needs or desires out of your dental plan in terms of a provider, you might not have access to that provider through the dental HMO plan. Keep that in mind. For those of you that do have some very specific needs that want a large network of providers to go to, our Delta PPO dental plan, we have 3 of them. These are really good options for those of you that want a lot of flexibility of who you want to see. Our PPO Silver plan is a $1,000 calendar year max. The PPO Gold is a $1,500 year max, and the Premier is $2,000 per year. The PPO Silver and PPO Gold use the same PPO network. This is the National Delta Dental PPO network. The Platinum level plan uses the Premier network. This is a larger network of providers, one of the largest in America, PPO dentists. So you get a really large network of providers with that Premier plan. You get a higher maximum benefit of $2,000. And if you happen to use out of network providers, their reimbursement level is very high for that. So if you are using a PPO dental plan for out of network providers, the Platinum plan would be your best bet. Speaking towards this calendar year max, this is when you hit this max, this is the most that the dental insurance company, Delta Dental, will pay on behalf of your claims. So if you're on the Silver plan, once they paid $1,000 towards your claims, they are done paying and you have to pay everything else. That's why some of these other, the Gold plan's a little bit better. You get $1,500, Platinum, you get $2,000. So that's one of the big drawbacks. The two big drawbacks of dental PPO plans: number one, it costs more than HMO dental plans, and number two, there's a maximum benefit. There is no maximum benefit with your HMO dental plans. So, but the benefit of PPO plans, lots and lots of choice, more providers, much more providers, and you can get in a little faster with your dental PPO providers. So let's talk about vision. We've got two vision plans. We got the Gold and the Platinum. Both of these plans are identical in that they give you an eye exam, a $10 eye exam every 12 months. Both of these plans are identical in that they give you a $25 copay for new lenses every 12 months. But they are different in this one area down here. You see the second number, or this third number here with Gold is 24, Platinum is 12. This is the frequency in which you get your $180 allowance for frames. The Gold plan makes you wait every 24 months. The Platinum plan gives you this benefit every 12 months. So once a year with Platinum, once every 2 years with Gold. These two plans use exactly the same network of providers. I think the Platinum plan is the best plan to go with just because of the value. It's about $23 a year more expensive to buy the Platinum plan, but you get $180 in benefits. So it makes a whole lot of sense from a financial standpoint there. So if you need dental, if you need vision plans, I recommend the Platinum level plan. Nothing in the world wrong with the Gold plan, just Platinum is just a better value. Let's talk about our enrollment. You're going to be getting an email. It looks just like this, asking you to enroll. You're going to hit the login button there. It'll take you to this screen here. If you didn't get the email, but you've already been in the system and used it with a username and password, you can go straight to healthyminds.ease.com and log in. Once you do so, you'll go through the overview, the profile, make sure you have your dependents in there. Once you get to the benefits, if you haven't done this before, the check mark and the X will all be gray. You need to make sure you hit one of these buttons here to say what you want to do. If you want to enroll or you want to waive. If you waive, it's going to ask you why you're waiving. It's going to mandate that you give us an answer. Any answer will do, even other, which would be none of your business, is fine. But you have to hit the check marks in order for you to scroll down and see which plans are available. As you can see, my current plan was the United Healthcare Gold plan. My new one, it pre-selects the exact plan. So that's very good for them to do that. It's very easy to see what it is. There's all these links down here. You can click these buttons and press these links and help you understand more about the plans. Once you go through all that, it'll give you a summary. There'll be a little button down here that says continue. You'll do that. You're going to hit the finish. It'll open up. It'll let you sign your forms. You'll click sign. You'll type your signature. You'll use your mouse to write your signature with your mouse on the screen, or if you're using a mobile device, you can use your finger to do that. You'll hit next. It'll take you through the application where you'll just drop in your signature at all the different places on the physical application. You'll hit finish at the top right. Once you're done with the finish, once you've finished and submitted it, you're all done. You'll get an email that says thanks for submitting your elections, and you are free to log out of the system at that point. So what's the next step? You're looking for this email to hit your inbox. You want to log in and enroll, and we're asking everybody to be done by no later than Friday, December 1st. If you've got any questions, if you need any answers, we are here from you, always happy to help, and here's our information here. Thank you so much for your time. I really appreciate the honor and the privilege of being your benefit advisor, and hope you have a great day.